Only mode.
Hello everyone, thank you for joining us and giving us your time. I'm Elizabeth Clemens, the presenter of Liveload Online and Neogenesis Systems, and together with Dr. Ocker, our tutor, who I will be introducing shortly, we're going to be showing you how and why you may want to consider adding live blood analysis to your practice. Dr. Ocker, our tutor, is a qualified naturopathic homeopathic doctor, and he's been teaching live blood analysis and utilizing it in his practice for 18 years now. So over to Dr. Ocker, who will explain the most important benefits of live blood analysis and how it can help you in your practice. Hello, Dr. Ocker, over to you.
All right, hi, thank you, Elizabeth. Started with the 5 key benefits of live blood analysis and how it will help you in your practice. So firstly, live blood analysis enables you to detect underlying imbalances at the cellular level. Also, the information gathered from a live blood test is vital in deciding on the best course of treatment with the patient. And somewhat related to the previous point is that live blood analysis allows you to monitor the efficacy of any given treatment. Live blood analysis also provides you with the means to demonstrate the negative effects of healthy dietary and lifestyle choices. And then lastly, live blood analysis creates an interactive dynamic in your practice. All right, so we're going to just run through each of these points in a little bit more detail. So the first point there, live blood analysis enables you to detect underlying imbalances at the cellular level. Now, these are the imbalances that complementary and integrative practitioners need to work with to allow the body's own mechanisms to facilitate healing. Now, these underlying cellular imbalances are also instrumental in the development of disease, and they therefore actually precede disease. This means that as practitioners, we have a technique here that is truly valuable, in preventative medicine, because we're able to identify imbalances at an early stage before the onset of pathology and take the necessary steps to reverse the process. Most other so-called preventative measures in conventional medicine are only really early detection measures, as they detect imbalances brought on by pathological processes that have already taken hold. Now, being able to view the condition of the blood and the blood cells in an unaltered natural state, with the cells behaving like they would in the body, allows the practitioner to achieve a much deeper understanding of the patient's individual health challenges and deficiencies. Most of the conditions detected by live blood analysis are not detected as easily or as sensitively by any other means. So we are therefore able to assist patients who have not had any success with other conventional or complementary practitioners, despite numerous tests and investigations. Secondly, information gathered from a live blood test is vital in deciding on the best course of treatment with the patient. Now, live blood analysis gives us a glimpse of each patient's unique internal cellular environment. We see the condition of this environment in real time, so the most important priorities are immediately obvious to the practitioners. This makes it easier for the practitioner to choose the best course of treatment with the patient. Live blood analysis allows the practitioner to monitor the efficacy of any given treatment. Because we're able to observe changes taking place in the body's internal environment or terrain in real time, we can easily monitor and track the patient's progress during treatment. Now, by assessing the changes taking place after implementing specific treatment protocols, we can establish whether a specific protocol is actually working or not, and make the necessary adjustments at a much earlier stage than what would have been possible without blood analysis. Now, as practitioners, we have access to such a wide variety of medicines and therapies, as well as so many different types of dietary regimens, that it can be quite challenging to work out what exactly needs to be done for each patient that you see in your practice. Patients often end up going from practitioner to practitioner and getting various diagnoses and treatments without ever knowing whether their condition is improving unless the symptoms improve dramatically. Now, we all know that in chronic conditions, the symptoms only start improving after the fundamental cellular imbalances have been corrected. And this usually takes some time, and with live blood analysis, we're able to show the patient during the course of treatment that their condition is improving at the cellular level, even if they might not yet be feeling a significant improvement. Right, and then live blood analysis also provides you with the means to demonstrate the negative effects of unhealthy dietary and lifestyle choices. So as practitioners, we understand what constitutes a healthy diet and lifestyle, and in fact many patients do as well, but unfortunately we still encounter much resistance from patients when we advise them to change their diet. Now, many people have emotional connection to certain foods, and changing one's diet is actually one of the most difficult things to do. That is why patients might agree with you during their consultation to make certain changes in their diet, but soon after leaving your office would soon start justifying not following your recommendations. Now, this lack of patient compliance is one of the leading causes for poor outcomes with holistic treatment programs. We simply don't have a pill to substitute a healthy diet. So we need to make a very powerful impression, almost a shock or wake-up call to provide or motivate the patient to make the necessary changes. Seeing the state of the blood, of their live blood on a screen compared to what a healthy sample should look like shows them the impact of their dietary and lifestyle choices and what they have had on their health, and motivates them to do whatever is necessary to correct them. Now, the positive changes that they've made is then reinforced by the practitioner being able to show them the positive changes that have taken place in their blood after following the protocol for a few weeks. This ensures that the patient stays compliant during the course of treatment until they are better, but also since they have seen the effects of making these changes, they are actually much more likely to continue with them and thereby maintain their health. All right, and then the last point, live blood analysis creates an interactive dynamic in your practice. Now, one of the problems with conventional medicine is that traditionally all the knowledge and also the responsibility for the patient's health lies with the practitioners. Now, many doctors don't explain their patient's diagnosis with them and what they can do as patients to improve their condition. This is not the case with complementary and integrative medicine at all, as we believe that the patient is ultimately responsible for his or her state of health, and that the practitioner should not only dispense medicine, but should also educate the patient about what he or she should do to achieve and maintain optimal health. Now, live blood analysis creates a very interactive and interesting dynamic in practice. Once the drop of blood has been taken from the finger and placed on a slide under the microscope, the sample is then viewed by the practitioner and the patient on the screen. The practitioner discusses the various anomalies of the patient's blood in detail with him, highlighting the symptoms that may be experienced as a result of a specific anomaly, the dietary and lifestyle changes that would have contributed, as well as the steps that need to be taken to correct this issue. Now, this makes it very clear to the patient that they shouldn't just expect pills, but that they also need to make the necessary dietary and lifestyle changes to actually get better.
Okay, thank you very much for that, Dr. Ocker. We've put together the most frequently asked questions about live blood analysis, which I'm going to put to you, Dr. Ocker. Is it possible to diagnose any
Right.
medical diseases with live blood analysis?
Well, no, live blood analysis is not used as a diagnostic tool. Although some indications for specific disease process can be seen in the blood, it's not meant to be used as to diagnose any specific disease. In cases where indicated specific disease are seen, one would still need to follow the normal investigations and procedures to diagnose the disease. The strength of live blood analysis actually lies in what we discussed above, in its ability to provide the practitioner and patient with a glimpse into the patient's internal environment or biological terrain, and to identify imbalances affecting the terrain that are contributing to the patient's condition, and in many cases were instrumental in the development of the patient's symptoms.
Thank you. So if it can't be used for diagnosis, why is it useful in a clinical setting? How will it help the patients?
Well, we've discussed the most important benefits earlier on, but this essentially comes down to what your goals are as a practitioner with your patients. You know, do you want to help your patients achieve and maintain optimal health, or do you just want to diagnose and manage diseases as and when they develop? We often talk about the difference between healthcare and disease care. Practitioners who are involved with integrative medicine and complementary medicine are not satisfied with simply treating their patient's symptoms with various pharmaceutical agents. They want to understand the physiological process that precede the development of a specific disease and what role various factors from the patient's diet and lifestyle may have played in the development of the disease. Understanding these causative and contributing factors then allows the practitioner to treat his or her patient more holistically, and it also helps them to understand how these conditions can be prevented in other patients.
Okay, thank you. And another question that comes up quite often is, how reliable is live blood analysis? How much variation is there in the findings in a patient's blood from one day to the next, for example?
Okay, well, some practitioners who are skeptical of live blood analysis mentioned this as one of the potential problems with the test. You know, that there are many factors that will affect the outcome of the live blood test, which may then mean that a patient's results will vary dramatically from one day to the next, based on what they had to eat or when they ate and how much water they drank, for example. Now, in practice, however, we simply don't see this type of variation. Of course, if a vegan decided to have a large steak a few hours before a live blood test, well, then we can expect to see the impact of this in the blood. But for patients following their normal daily routines, the results are always accurate. We actually see the opposite of what is suggested here in practice. Patients tend to present with a very specific mix of anomalies that don't change unless the appropriate course of treatment is completed. So they would have had a list of perhaps 10 anomalies at the first appointment, and if they don't make the necessary changes, we will then see the same 10 anomalies when they come back, even if it's several years later. It's almost like a metabolic or functional fingerprint that we're seeing, and it won't change unless very specific steps are taken to address it.
Okay, thank you. So do you do live blood analysis on all of your patients?
Absolutely, yes, I do. You know, I can't really imagine not using live blood analysis because it helps me helps to guide me so much in practice. There really is no other test that can compare with live blood analysis in its ability to detect the most important health challenges that any particular patient has, as well as being able to monitor then how the condition improves with treatment. Conditions that used to present quite a challenge before for me have become very easy to deal with because I can see exactly what the root cause of the problem is. Now, before using live blood analysis, I had to rely on purely the clinical picture and also what we could probably refer to as crude laboratory tests and investigations, and also perhaps a bit of luck. Often found myself second-guessing my decisions in terms of treatment, wondering whether if there was something else in the case that I may have missed or overlooked. But with live blood analysis, because we're scanning the sample for any visible anomalies, instead of choosing what specific tests to perform on a form, there really is very little risk of not finding the most relevant anomalies. I've seen it work so many times, so consistently, and I've seen it help people who have tried nearly every other test, that I feel that if I don't do it on every client or every patient, that I'm likely to miss the boat with them completely.
Okay, so what does it involve and what is the clinical research behind it?
All right, well, in terms of what it involves, it's basically a visual analysis conducted on 2 blood samples, a live sample and a dry sample. Now, the live blood part of the test involves looking at the live blood sample under high magnification using 2 different types of applications in microscopy, bright field and dark field. The dry blood sample is viewed after the live sample under a lower magnification, looking at the specific pattern of coagulation. Now, in essence, it's a nutritional test, so we can see nutritional imbalances and other imbalances that can be addressed with changes in diet and lifestyle and specific natural treatment interventions. As I mentioned earlier, it's not a tool it's not used as a tool to diagnose medical diseases. The type of conditions that we are able to diagnose with live blood analysis are in fact conditions that are understood in the field of natural medicine and not completely accepted in conventional medicine yet. And this is also the main reason why live blood analysis is not fully accepted by conventional medicine. We are using a device here that can detect conditions that they, in conventional medicine, do not recognize as being real, valid conditions, like, for example, candida, the need for detoxification, heavy metal toxicity, latent tissue acidosis, and so on. So here we have a tool that can actually accurately detect those conditions, so it's going to be very unlikely that it would be accepted by conventional medicine. Now, also in terms of clinical studies and clinical research, it's very difficult to put together a clinical study for live blood analysis because many of the conditions that we are able to detect with live blood analysis cannot be detected or verified by any conventionally accepted test to the same degree of accuracy and sensitivity as live blood analysis. So that's one of the main reasons why there's only a small amount of research on live blood analysis, specifically clinical type of research or scientific studies. This is, of course, a large part of, there is, of course, a large part of live blood analysis that is purely based on normal standard hematology. So as you know, that information has been researched many years ago, and there really is no need to subject that information to any further research. However, because of the differences between live and stained samples, there are many other signs and indicators that don't form part of hematology, and there have been some small-scale studies that were done, and we can definitely go through those in more detail, perhaps in another webinar.
Okay, thank you. Now, why do some doctors think live blood analysis is not legitimate?
Well, I think what I mentioned earlier about the specific conditions that we're able to detect with live blood analysis is quite relevant to this question as well. We also have another webinar where we discussed this topic in detail, and we'll be happy to send the link to anyone who would like to view this.
Thank you. And how close is live blood analysis to normal hematology?
Well, that's actually quite an interesting question because, as I said earlier, a fair degree of information in live blood analysis is purely based on standard hematology. So in terms of the specific anomalies that we also see and recognize in conventional hematology, the interpretation would be very similar. So from that perspective, it's very similar to conventional hematology. But there are, of course, also some very fundamental differences. The fact that we're looking at live blood makes a very big difference. In conventional hematology, the blood is drawn from a vein, it's placed in a test tube with an anticoagulant. The blood is then sent off to a laboratory where a different technician will actually look at the blood under a microscope. Before analyzing the blood, they also stain the sample and basically kill the blood cells to preserve the sample. So you can actually say that conventional hematological testing, or what they call a peripheral blood smear, is a much cruder type of analysis. It's performed on essentially dead blood at a low level of magnification. Many of the anomalies that we view as being significant in live blood are actually disregarded in conventional hematology because they're seen as part of the staining process or byproducts of the staining process. Whereas in live blood analysis, because the blood is collected from the finger and placed immediately on a slide and viewed straight away under the microscope under high magnification, and absolutely nothing is added to the blood is viewed exactly like it is in the body. So any anomalies that are seen are there because, well, that is what the condition of the blood is like, not because of anything that was added to the blood. Now, one of the earliest proponents of live blood analysis, Marcel Bessy, was a French hematologist who lectured at the University of Paris in the 1960s and 70s. He wrote a book, or a number of books actually, describing the value of evaluating blood in a living, unchanged and non-stained state. He argued that all hematology labs should change from analyzing stained blood samples to live samples, mainly because the with live samples you're able to observe in real time the dynamic process of life at the cellular level. Now, he said that you can capture events and sequences that are impossible to see in static, dead, stained samples.
Okay, thank you. So what's the best way to get started in live blood analysis?
Well, to benefit from live blood analysis, you do really need a very good course, a high standard of training with as much information as possible. The theory is very important, but the practical aspects of live blood analysis are equally important, because if you're not able to take blood samples correctly, then your results will not be reliable. Your course needs to be comprehensive, and the equipment that you use, your microscope system, needs to be up to the correct specifications so that you're able to use live blood analysis to its full potential from the very beginning. Now, I've often seen people who want to add live blood analysis to their practice who perhaps don't want to invest in a good enough system. They tend to start with a very basic system that doesn't really allow them to see everything that they should be able to see, and they never really then fully benefit from live blood analysis. So there's the theory, the practical proficiency, and the correct equipment are all crucial.
Okay, thank you for that. So for those of you who are interested in knowing more about the live blood analysis training course, we have put together some information here. Live blood analysis and neogenesis systems have been teaching naturopathic doctors and practitioners all over the world for the last 3 years. The course was put together with the convenience of attendees in mind, i.e. no expensive travel and accommodation expenses required. But most importantly, we found that being able to repeat the lessons was very helpful for attendees in learning this technique. For that reason, all of the lessons are recorded and students have access to them for as long as they like and as often as they need. Now, this also helps if attendees have to miss a lesson or if the timing of the lesson is inconvenient. The in-house or in-situ courses tend to leave students with just a microscope, a manual, and what they can remember. Now, at Liveload Online, We offer 12 live interactive webinars with questions and answers throughout. We also supply a 500 plus page manual, 2 wall charts to help identify anomalies. We offer a training site where attendees will find a library of pictures and videos to help them along with lots of useful information to help them in their practice. And in the first module, we teach students how to use their microscopes and how to become proficient in using them. We also provide backup and a private Facebook page where all attendees are able to post their findings and learn along with other students, and present and past students and attendees of Liveload analysis. They're able to post their findings, compare notes, and learn together. So attendees can study from the comfort of their own home, office or practice at their own pace, in their own time, and getting all the backup that they need. The course is very comprehensive and covers all aspects of Liveload analysis, including the pleomorphic and medical perspectives, and provides specific treatment protocols. The course is CMA approved, that's the Complementary Medical Association, and we award a certificate on submission of 2 test cases. We have successfully trained many health practitioners from all around the world, and practitioners certified by Liveload Online and Neogenesis Systems have been trained to a very high standard and level of proficiency. So, Dr. Ocker, do you have some test cases or case examples?
Yes, we do have a few case examples just from some patients that have actually completed courses of natural treatment after having their blood analyzed, and this is just to illustrate the type of changes that can take place and also the type of anomalies that can be seen initially in blood samples. So we'll just go through a few of them. All right, so this is from a lady, a 46-year-old female suffering from ulcerative colitis. Now we've got some examples before and after treatment. You can see this is approximately 3 months later that the follow-up pictures were taken. So before treatment, there's various that we're going to be looking at. Obviously, without the background in training, you won't be able to identify them, but we'll cover the basics here. You can see the difference between the pictures very clearly there. The picture on the left before treatment, you can see that the red blood cells are all sticking together. This is a condition called rouleau, and very typical of any digestive and intestinal challenge. And you can see how that has cleared up completely after 3 months of treatment. The other image here, you can see the background is dark, and this example is a slightly different picture. This is a dark field image, and what we're looking at there are the lines between the cells, very clearly visible, quite a dense pattern of those lines between the sample. Now, that's an indicator for liver stress, and this is quite common with digestive conditions as well. And you can see that there's a dramatic improvement with that in the follow-up visit. All right, and this is also dark field, just to show again the difference with the degree of liver stress seen on the left-hand side and the overlapping of the blood cells compared to the picture after treatment, where the cells have separated completely, and we're not really seeing a significant degree of liver stress in this example. Right, and the last image here is actually from the dry blood test. It's one of the dry blood samples, and we're seeing large white round patterns towards the center of the sample. This is called a bowel pattern, and this is really typical of any major bowel challenges, especially when there's inflammation in those areas, and really a dramatic degree of improvement here in the follow-up visit.
Well, thank you very much.
And incidentally, thank you. We're going to go through a few more examples, and incidentally, you know, we can see that the samples have improved, but of course the symptoms in these cases also improved dramatically after treatment. Okay, so in this example we have a 52-year-old male suffering from hypertension, insulin resistance, and dyslipidemia. Very interesting picture on right there, the live blood example. We can see the sort of grayish structure towards the center of the image. That's actually a group of platelets or thrombocytes. Thrombocyte aggregation is a very important risk factor in cardiovascular conditions, and there's been several books that's been written where it's highlighted as a major indicator for cardiovascular disease risk. And usually when we encounter these groups of thrombocytes, we compare the group to the size of the red blood cells, and you can see the size of this group is really enormous compared to the red blood cells. So this is really a very high-grade finding that we found with this particular patient. And looking at the example on the right-hand side after treatment, the small grey spots that are visible here and there between the red blood cells, those are actually the platelets, the thrombocytes. That's what they should actually look like when they're in an inactive state, when they're not sticking together. So also a really significant improvement there. All right, the same example here. Also another group of thrombocytes visible in the screen or in the image on the left-hand side, and the degree of improvement there. We can actually see a very small group of thrombocytes on the right-hand side image here. Now this compared to the red blood cell is still approximately the same size as a red cell, so this would still be considered as a relatively low grade finding. Okay, and you can also see the shapes of the cells here. There's a really dramatic improvement here. The shapes of the cells on the image on the right-hand side, all the little red blood cells are nice and round and regular, whereas the cells on the right-hand side, on the left-hand side rather, you can see that there's a large number of them that are irregular in shape. And then the light grey structure towards the right-hand side on that image on the left is again a group of thrombocytes. This is just again with a dark field. And this is then from a dry blood sample. And what we're looking at here is actually that lighter area that's visible towards the center with those black lines that are in a sort of a broken up pattern in the middle there. Now this is called broken fibrin in blood analysis, and this is seen as or considered an indicator for a blood sugar imbalance, and it's definitely linked to conditions like insulin resistance. A very sensitive indicator for this condition, and we're often able to see this long in advance before any other investigations which show any abnormality. We can see the degree of improvement that has taken place there. The example on the right-hand side is really what we aim for in dry blood samples. That's what we want to see in a healthy example. All right, and in this case, a 65-year-old female suffering from rheumatoid arthritis, hypothyroidism, and also hypertension. Some really interesting samples here as well. You can see the difference between these pictures straight away. The example on the left-hand side before treatment, many of the red blood cells are looking really unusual here. They seem to have indentations. Now, this is known as cloud patterns in live blood analysis, and this is very much linked to inflammation. Now, as you would know, rheumatoid arthritis, we'd expect there to be a high degree of inflammation in the system. Also, the very large obvious structure in this lower image on the left-hand side, green reddish in color, that is actually a uric acid crystal. Now this we really often observe in practice with patients with long-term inflammatory processes, inflammatory conditions, and any type of arthritic condition. We usually would see these crystals very clearly in the sample. And again, with these structures, we compare them, or the size of them, to the size of red blood cells. And you can also see that this crystal is very large compared to the red blood cell. All right, and just a dark field example on the On the right-hand side, just showing that there's a great degree of improvement. We were not actually able to see any uric acid crystal during the follow-up. All right, and just this lady's dry blood sample. So we also look at the amount of white in the dry blood sample and how much of the blood of the red has been displaced by these white areas. Now this type of displacement of the blood is actually linked to high levels of acidity in the system and high levels of inflammation as well. Now you can see the change that has taken place here. There was actually a very high percentage of displacement of the blood in the initial visit, and after treatment about 6 months later, you can see that there's most of those areas have closed and have knitted together, and we're not seeing nearly as many white areas. And in this image, we've zoomed into one of those white areas. So we're looking at it at a higher level of magnification, and we're looking at all those little structures, all those spots within the white areas. Now these are things like sialic acid and Heinz bodies, and we often see those as a result within these white areas as a result of tissue damage taking place as a result of inflammation and over acidity. Very important to monitor as well, and you can see the improvement taking place there. You know, going into the lighter areas that we're seeing in that example, we're not really able to see any of these be it sialic acid or Heinz bodies within those areas. All right, so that brings us to the end of the webinar.
Well, thank you very much for that, Dr. Ocker. Very interesting. And thank you very much for joining us. We really hope that you've enjoyed the webinar. And if you have any questions, please email us at info@livebloodonline.com. And we look forward to receiving any questions from you. So thank you very much for your time. Thank you very much, Dr. Ocker.
Thank you very much.
Thank you. Goodbye.
All right, bye-bye.